The Obama administration has announced that it will hold a forum on the high prices of prescription drugs. This forum will be held next week in Washington, D.C., and its purpose, supposedly, is to bring insurers, drug companies, and consumers together. Democrats Hillary Clinton and Bernie Sanders have attempted to tackle this issue already, as according to the Department of Health and Human Services, drug prices rose overall by 12.6% last year. Here with me now is Director of Public Policy for Aimed Alliance, Stacey Worthy. Stacey, thanks for being with me today.
Thank you for having me.
Now, you've said that this forum Obama is holding on high drug prices is unnecessary. Why do you say that?
Well, what we're seeing is a knee-jerk reaction to a handful of bad actors in the pharmaceutical industry. And those bad actors can be dealt with, and they are being dealt with already, through state legislation or state enforcement actions. State attorneys generals are already investigating. But what nobody is talking about is the bad actors in the insurance industry. And this bad action is industry-wide. They are hiding their profits to justify price increases, price hikes, to the point where hardworking families cannot afford their health insurance, and they're paying more for their insurance monthly than they are for their rent or mortgages.
Right. Now, your company, Aimed Alliance, is a nonprofit organization that works to improve healthcare. Are these some of the concerns felt by your company, or can you share with us some of those?
Absolutely. So there are a lot of deceptive practices that the insurance industry is employing. For instance, they're hiding their profits. The Blue Cross of California, for instance, that's a nonprofit insurer. They hid $4.2 billion in their financial reserves. They also paid these extremely high executive compensation packages, way above market level. Then they were able to justify increasing their premiums because they had hid those profits. As a result, the state did an audit and they lost their nonprofit status. Now, this is happening industry-wide. And then on top of that, we're seeing that patients are not even getting quality. So even though premiums are increasing in the double digits, in Utah, premiums are going up 45% for exchange plans. And yet, patients are still being denied care. The insurers are telling them they have to get sicker before they can afford the top quality care of cures, of medications that would cure their diseases.
Now, is the answer to this, in your opinion, price controls, more involvement from the government, or is the answer supply and demand and less of a monopoly by the drug companies?
No, price controls are not necessary. To the extent that you have the bad actors in the drug industry, as I said, there are state laws in place already. There's anti-price gouging, there's anti-competition laws, and state attorneys general are already stepping in and investigating. On the insurance side, what we need, again, at the state level is to enact stronger consumer protection laws so that consumers can feel confident that when they need insurance, it's going to be there for them. And have more transparency with their insurance.
Sure. Now, when you say stronger consumer protection laws, can you give us an idea of what that would look like to us, the American people?
Absolutely. So in some states, they've already started enacting consumer protection laws to cap the copay. So that means that the out-of-pocket payment that you would make towards your premium is capped at a specific amount. So patients won't have to worry that when they need that drug for cancer or for HIV, that it's not going to break their bank. Or there are also laws that are being enacted to provide more transparency so that when consumers go into that exchange, they know exactly what they're looking for, what they're getting, and what's going to be covered and what's not going to be covered.
Right. Now,
and that's at the state level.
In your opinion, is this whole, it sounds like a tangled web. Is this all caused in part by Obamacare, by government being too involved in the industry, by requiring people to get a certain level, to pay a certain amount, or then trying to cover them when they can't? If government pulled back from this, would a lot of these issues go away?
I think it's it's a complicated situation because you have Obamacare. It has a lot of flaws. There's a lot of opportunity to exploit the loopholes. That's what we're seeing. We don't need more government involvement. Unfortunately, it's very hard to repeal something like Obamacare, but there are fixes that can be put into place, and that's what I'm talking about here with the state level actions.
Right, and now Obama is advocating for Medicare to negotiate directly with the drug companies about prices. That's currently, as you know, forbidden by law, and Republicans have said this will increase the already out-of-control Medicare spending. What are your thoughts on this?
Absolutely. I think negotiations are not necessary. The government does not need to step in. Supply and demand works as it is already. And once you have the government stepping in, then drug prices drop below their market value. Insurers cannot invest in research and development, which is necessary to create new cures for drugs. For instance, I don't know if you heard the news today, but Pamela Anderson just announced that she's completely cured of her hepatitis C. Now, without the funds for research and development, you don't have those cures. So, no, the government should not be stepping in to negotiate Medicare prices.
Now, what's the best forum, no pun intended, to discuss this type of issue with the American people?
Well, Liz, I think the news is the best forum. I think what you guys are doing here is perfect. This is the best way that we can educate consumers so that they know what they can expect from their health care, and so that they can call their state legislatures and demand more transparency and better consumer protection. Because, as I said, insurance should be there for them when they need it.
Stacey, I appreciate your input on this issue. I hope you'll join us again. Up next, my final point of the night and of the week. Don't go anywhere.